Okay, so week 10 had two components. One is we have this thing called alpha fetoprotein. So what it's doing is preventing estradiol from crossing the blood-brain barrier in females. If estradiol crosses the blood-brain barrier, it essentially defeminizes the brains. Hence, in males, we don't have the alpha fetoprotein. Therefore, estradiol, which actually is derived from testosterone, crosses the blood-brain barrier, defeminizes the brain. Hence, we get the male surge center versus the female surge center. Alpha fetoprotein prevents estradiol from crossing the blood-brain barrier in females, and therefore we get the female surge center. A main characteristic is that male's LH is low and continuous, so it's very low amplitude basal level, versus females have that big LH surge. In terms of menarche, what is this? This is just your first menstrual period and essentially the age of when you can also have your first ovulation as well. Name a couple sex characteristics. So let's talk about males and then females. For males, primary is going to be the genitalia, secondary is going to be hair. Interestingly, baldness is a characteristic of high testosterone. Vocal cords are going to thicken, so you're going to have a lower voice, and then you're going to also have thicker skin there. In terms of the females, we're going to have primary, you're going to have their genitalia development, and also going to have vaginal mucus. Secondary characteristics are going to be long bone growth, breast development, and increased hydration. Now, in terms of menopause, what is this? This is essentially 12 months of amenorrhea, or essentially you're not having, ovulation for more than 12 months, really. So you're going to have perimenopause to menopause. Perimenopause is just the time period before menopause. And in perimenopause and menopause, you can have certain things. You can have hot flushes, increased bone reabsorption, which can lead to osteoporosis, weight gain, increase LDL. LDL is your bad cholesterol, decrease HDL, and as such, increased risk of cardiovascular disease likely from atherosclerosis. Susceptibility, you can also have mood disturbances there. Now, the main cause of having this is because we're essentially losing the estrogen. Without getting too much into the pathophysiology, our FSH and LH rise due to decreased sensitivity to compensate for our decreased estrogen. However, what ends up happening is long term, this doesn't really do anything, and our estrogen is still decreased. Now, what this does to the follicular phase is that we get a shorter follicular phase because of that FSH and LH rise. However, we do have a normal luteal phase. Now, we can do this thing called hormone replacement therapy, which can help alleviate symptoms. However, this is not a long-term treatment. I don't remember the reason for it. I do recall that it had something to do with increasing our cancer risk, because essentially we're overstimulating the follicles, and any overstimulation of multiple dividing cells without control can increase our risk for cancer. And also to note is that hormone replacement therapy of estrogen does not reduce our cardiovascular problems. However, it can seem to mitigate some side effects such as those of Alzheimer's. Again, it's just to help alleviate symptoms, not a long-term thing. Other things that we can do to help alleviate symptoms that are not medical related could be dressing in layers, vitamin D to help with that osteoporosis, regular exercise to increase our cardiovascular health, to decrease those negative impacts of cardiovascular atherosclerosis that we can get can also help. Maybe know 3-4 examples for that. Be able to summarize what menopause is, what menopause does to the body, and also be able to give a summary of maybe 3 sentences of what effect does it have on your cycles, and what effect it has on your variability in the menstrual cycle. I've just given the FSH and LH rise and short follicular phase, normal luteal phase as some examples that can be used.